Okay, I'm sharing my screen now. Okay, welcome everyone. Welcome to Casey's pain management class. Thank you so much for taking the time to join us here today. I really hope that this will be worth your while. I am gonna be streaming this live to YouTube. So we're just gonna talk, and at the end we'll have a question and answer session. Uh, Pain management. Before we jump into pain management, I just have to put a disclaimer out there. I am not a physician, so I cannot treat you. This is just general information, and it's actually being presented from a nursing perspective. So please consult with your physician before starting or changing any suggestion or supplement or any regimen that you may find today. This class was not created to give any personal medical advice or treatment. So if you have any acute problems or questions, I would refer you to check with your healthcare provider. The reason I created this class is to empower you with the words and thoughts, give you some information so you can have an effective medical visit. I also would like to give you education. I would also like to give you patient education in very simple terms. So that is the purpose of this class. I hope it helps. I'm gonna just begin with an introduction because many of you may already know who I am personally. My name is Casey Pacheco. I am a registered nurse. I've been working in healthcare for over 15 years, but I've been a registered nurse for just about 10 years. And I am a mom, a new mom. I have a 7-month-old baby. His name is Shira. You're gonna hear him in a little bit. My husband in the picture, you can see his name is Anthony, and he is about halfway through nursing school. You're gonna hear people might say, where's her voice sounds different. She has an accent. I was raised in Trinidad and Tobago. And so you hear that Caribbean flair. That's because I'm from the Caribbean originally. And on a professional note, I have worked in many different settings. So I've been from hospitals, clinic, triage, home health, insurance, occupational, hospice, private duty. I don't know everything, but I have a lot of experience in many different things where it comes to nursing is concerned. Some people asked about donations to this project. Right now, we're working in a little bit of a different currency. If you're a believer, you know what I'm talking about. So no money at this time. It is really just my privilege to present this information to you. I really want to keep my friends and family well informed and healthy. And honestly, this is for everyone, because if we have a healthy population, it really makes our job as healthcare providers a bit easier, because if you think about it, the emotional toll it takes caring for someone who is not well or unfortunately is not doing well, it takes a toll on our health as well. So if we can keep you healthy, it keeps us healthy as well. I'm not the expert on any one topic, so nobody really is an expert. So this is just, I'm just sharing from a nursing perspective, things that I have gathered. And if you know more about it, or if you know differently, feel free to reach out to me, because I love learning and I welcome knowledge. So with all of that said, we can get into the presentation about pain. what is pain? Now, my coaches, when they were helping me put this presentation together, they wanted to know, why did you use a car? What does driving and keys, what does that have to do with pain? Well, this is the purpose of this presentation. I'm not here to tell you what to do, but I really want to put you into the driver's seat of your health. I want to empower you with my words and with whatever knowledge I know. So when you think of pain, it's communication. It is a response. And people say, oh, I'm in pain. That is so negative. They think pain, negative, bad, stop it. But actually, pain is a positive response. Just think of it. If you never had pain, how many times we walk around and we just have a little ache, it's not really painful, it's just uncomfortable. But when you get that pain, it moves you to do something. You're calling the doctor right away. You might even drive to the hospital. Pain makes you do something. And that's kind of how the creator designed us, so that we can address the hurt that we feel. So it actually is a good thing, and it is communication. So a simple illustration for you is, as if you think of your body as a vehicle, the information you take in today, it's like me giving you the keys so that you can navigate and choose what care and treatment fits you better. You will be well informed to drive your own healthcare. So some people, they think, oh, that's really scary, and they give the keys away, especially when they're in pain. They just want anybody else to take care of them. But this presentation is to give you your keys back so you can take care of yourself. My quote is that us taking care of our health should not be out of desperation. I want you to be inspired to care for your health, not from a place of desperation, not from a place of, I need crucial, critical help. And this is where right now, if you are not in pain, I commend you for even coming here, because people think, oh, I'm not in pain, I don't need to be here. But I don't want you to wait till you're in pain to seek help and to know what to do. So if you're not in pain and you're here, thank you for coming. So let's talk about, what is pain? Pain, whatever you say pain is. Whatever is uncomfortable, whatever hurts you, it is pain. In nursing, they tell us whatever the patient says, whatever they say pain is, that's what pain is. It's your brain's response to a receptor. And we're going to go into this a little bit deeper. But why I'm saying it's your brain's response, because phantom pain, that's pain where you don't actually have the limb, but you feel it. That's real pain too, and we treat that as well. And emotional pain, that's something many people are a little bit hesitant to talk about. But emotional pain, that's real pain too. And as we go into our discussion, you will see how emotional pain can actually really inhibit physical pain. I put a channel, it's a YouTube channel called Psych2Go, because when it comes to discussing emotional pain, a lot of people, they don't really have the terminology to describe what they're going through and what they're feeling. So that's a resource online, free of charge, where you can actually go and not diagnose, but you can actually go and identify with some of the things, some of the feelings, some of the thoughts that psychologists put there. It's just a resource for you to help you to identify and communicate that kind of pain. On a professional level, when I worked in post-operative care, I noticed that patients who were emotionally healthy recovered well from surgery. So emotional and physical pain, they actually do go hand in hand. But some people suffer from emotional pains that has no physical manifestation, but it is real pain. Okay, so the next, we're going on to medical versus nursing management. We'll talk about this a little bit because medical management of pain and nursing management are two different things. Some people think, oh, I'm sick, so I'm just gonna go to the doctor. He's gonna give me the pain medicine. The nurse is gonna give me the ticket, and that's it. But they're actually two different things. When the doctor treats pain or disease, he's treating the actual problem. However, the nurse is treating the person. So we'll talk a little bit more. We have a couple more slides about this, but first of all, I'm going to talk about the medical management of your pain versus that's what the doctor does for your pain. And then we'll dive into a little bit of how the nurse manages your pain. Okay. So when you go to the doctor, you say, doctor, I'm hurting, right? And what's the first thing the doctor starts asking you? A lot of questions. And when you're hurting, you do not have, you're like, why are they asking me all of these questions? Well, remember that slide we talked about pain is communication. So when you're in pain, your body is communicating, something's wrong with me. And you know fully well, if your arm's hurting, if your foot's broken, you know what that is. However, you have to find a way to communicate that to the doctor. And in healthcare, we use this mnemonic called PQRST. I'm not going to get very complicated with the mnemonic, but I'm just going to go through it just so you can know how to effectively communicate the pain you feel to your healthcare provider. So NP, the first thing he wants to know is what's really provoking the pain? What makes it better and what makes it worse, right? And then he'll ask Q, like what quality of pain? So that's where your adjectives come in. Is it a stabbing pain, aching, sharp, burning, dull? What does it feel like to you? Then he will ask about radiation. Where is it radiating to, or where is it spreading? Is this pain moving, or is it standing still in your body? Then severity. Now, usually here in the United States, we use a pain scale of 1 to 10. So your provider will ask you on a scale of 1 to 10, can you rate your pain for me? Now, I'll spend a little bit of time on this. I have a lot of patients and they think it's funny, or they just want to tell me the intensity of their pain. And you say on a scale of 1 to 10, what number would you rate your pain? And I hear 15. They come in with a 15. And they think, I understand. I really do understand. But as your friend, I would just suggest that you stay within the 1 to 10 ratio. Why would I say that? Well, given a higher number off of that scale, you leave it to the provider to figure out where your pain really is. So I'll give you an example. Someone with chronic pain, maybe 10 years ago, that type of pain that they experience is a 10. But 10 years later, after coping with that pain, living day in, day out with it, they are able to tolerate it. So that 10 over 10 years now is more like a 6 or a 7. And when they go to the healthcare provider, even though it's a 10 to everybody else, for them, that pain, when they ask them, it's really a 6 or a 7. And that's because when we ask to rate your pain, it's in relation to how much it's affecting your life. So a 10 would be you are crippled. You cannot do anything. You can barely even talk to me right now. Your pain is extreme. Whereas a 1, you can, it's practically no pain for you. So that's just a cue on severity. You really want to be in the driver's seat as saying how severe it is. And that comes into when you're getting medication, the doctor really wants to see if the medication is working. So if you say 15 and then they reassess you and you're at a 10, in the industry, 10 is as high as you can go. So they won't see any improvement. Okay, enough on severity. Timing, temporal factors. So they want to know, is this pain coming and going, or is it constant? And how long does it last? When did it start? When did it go away? When did it come back? They want to know about timing. So that's your PQRST. A nursing tip for you would be, as you're waiting to see the provider, maybe in the hospital or the doctor's office, just run through these things in your mind so that when they start asking you questions, you will be prepared. It wouldn't be an inconvenience, or you have to now start to think about it. Emotional pain is not the same. You cannot really use this scale for it, but that's where that resource will come in. You get the terminology to describe how you're feeling. So now that we talked about rating the pain, let's go a little bit into treatment. So your medical provider will treat the pain, usually using pain medication. Or a lot of people, colloquially, we just say painkillers. Give me a painkiller or pain reliever. Some are not sure of exactly how pain relievers work. So I just have a video here to show you what is happening. Before we go into talking about the medication, let's see how simple aspirin and Tylenol works in your body. And so I'm going to play this video.
Say you're at the beach and you get sand in your eyes. How do you know the sand is there? You obviously can't see it, but if you're a normal, healthy human, you can feel it. That sensation of extreme discomfort, also known as pain. Now, pain makes you do something. In this case, rinse your eyes until the sand is gone. And how do you know the sand is gone? Exactly, because there's no more pain. There are people who don't feel pain. Now, that might sound cool, but it's not. If you can't feel pain, you could get hurt or even hurt yourself and never know it. Pain is your body's early warning system that protects you from the world around you and from yourself. As we grow, we install pain detectors in most areas of our body. These detectors are specialized nerve cells called nociceptors that stretch from your spinal cord to your skin, your muscles, your joints, your teeth, and some of your internal organs. Just like all nerve cells, they conduct electrical signals, sending information from wherever they're located back to your brain. But unlike other nerve cells, nociceptors only fire if something happens that could cause or is causing damage. So, gently touch the tip of a needle. You'll feel the metal, and those are your regular nerve cells, but you won't feel any pain. Now, the harder you push against the needle, the closer you get to the nociceptor threshold. Push hard enough, and you'll cross that threshold and the nociceptors fire, telling your body to stop doing whatever you're doing. But the pain threshold isn't set in stone. Certain chemicals can tune nociceptors, lowering their threshold for pain. And when cells are damaged, they and other nearby cells start producing these tuning chemicals like crazy, lowering the nociceptor's threshold to the point where just touch can cause pain. And this is where over-the-counter painkillers come in. Aspirin and ibuprofen block production of one class of these tuning chemicals, called prostaglandins. Let's take a look at how they do that. When cells are damaged, they release a chemical called arachidonic acid. Now, two enzymes called COX-1 and COX-2 convert this arachidonic acid into prostaglandin H2, which is then converted into a bunch of other chemicals that do a bunch of things, including raise your body temperature, cause inflammation, and lower the pain threshold. Now, all enzymes have an active site. That's the place in the enzyme where the reaction happens. The active sites of COX-1 and COX-2 fit arachidonic acid very cozily. As you can see, there's no room to spare. Now, it's in this active site that aspirin and ibuprofen do their work. So they work differently. Aspirin acts like a spine from a porcupine. It enters the active site and then breaks off, leaving half of itself in there, totally blocking that channel and making it impossible for the arachidonic acid to fit. This permanently deactivates COX-1 and COX-2. Ibuprofen, on the other hand, enters the active site but doesn't break apart or change the enzyme. COX-1 and COX-2 are free to spit it out again, but for the time that ibuprofen is in there, the enzyme can't bind arachidonic acid and can't do its normal chemistry. But how do aspirin and ibuprofen know where the pain is? Well, they don't. Once the drugs are in your bloodstream, they're carried throughout your body, and they go to painful areas just the same as normal ones. So that's how aspirin and ibuprofen work. But there are other dimensions to pain. Neuropathic pain, for example, is pain caused by damage to our nervous system itself. There doesn't need to be any sort of outside stimulus. And scientists are discovering that the brain controls how we respond to pain signals. For example, how much pain you feel can depend on whether you're paying attention to the pain or even your mood. So pain is an area of active research. If we can understand it better, maybe we can help people manage it better.
Okay, so that should have given you a little bit of an idea of how pain relievers work. A tip on that video is pain medications, they don't take care of the problem. Basically, if pain is communication, pain relievers stop that communication that's happening to your brain. So some people, they think when their pain medication is working, that their problem is over, but it doesn't cure the problem. It just stops that communication from happening. So your brain is not recognizing the pain. So as we go into talking about medication, we'll talk about medication from basically what your nurse wants you to know about each medication. And we'll just do a few common, we could do pain medication class all by itself. That could be its own topic. But for the purposes of today, we'll just talk about a few over-the-counter medications and then a few narcotics. So the first one we'll talk about is Tylenol or acetaminophen. That's the brand name, the real name. The brand name is Tylenol, the real name is acetaminophen. And it works for mild pain, reduces fever. And what I want you to know about this medication is be very careful of overdose. 3,000 milligrams per day when you're feeling sick or you are hurting, it is so easy to for your days to run into each other, and then you start taking cough or cold medicines that contain acetaminophen, and before you realize it, it's easy to go over the maximum. But for the sake of your liver, try to stay within the 3,000 milligrams per day, unless directed differently by your physician. So Tylenol, that's a common one. Aspirin, everybody knows it. It used to be used a lot for pain, but now they're using it more so for the blood thinning effects. And because it's so harsh on the stomach and it's so very easy to bleed when you take aspirin, um, they're even a lot of people with heart disease, they tell you to take it every day, but they're starting to go away from aspirin on a daily basis just because it's so harsh and it's so easy to bleed, especially internally, taking aspirin. You want to look out for signs and symptoms of bleeding, especially on the internal. So if you start having like really dark stools, um, that can be a sign of internal bleeding, and you want to check with your provider if you notice any discoloration of your stools, more so in a darker color. Um, Chest pain. If you're having chest pain, take an aspirin, you wouldn't go wrong because it really works not just to take the pain away, but more so to thin the blood. So if you're having a heart attack, it really has, it really makes the blood thinner and it really would help. It's one of the medications, if you don't take it at home, they will give it to you when you come to the hospital. So that's a good one to remember. Ibuprofen is another one that we'll talk about. A lot of people take this for pain that comes with inflammation. So if you have any sprains or strains, this is a good pain medication to take. And I put here a rice, that is RAS, putting ice, compression, elevation. When you do those things along with taking ibuprofen, it usually works best. Ibuprofen is also hard on the stomach. So you want to remember to take it with meals and usually a full glass of water, because you could do a lot of damage to your stomach taking it on an empty stomach. And the last over the counter, it's Aleve. And Aleve, some people, they love it. Some people, they say it doesn't really do much for them. It's a good drug for pain relief because it works so long. So it can last up to 12 hours. And usually people combine it with other medications. So they'll take like an Aleve and an ibuprofen to just stretch it out a little bit. And you want to take it with food as well. But they want to stretch out Aleve so that instead of having to go to something stronger, they do a combination. I'm not suggesting any combination without talking to your doctor, but it is an option that some people do. A lot of people notice Aleve is good for like cramps, anything soft tissue. It helps menstrual cramps, or some people, they say it works really well, and some people, they use like another form of medication. So these are over the counter medications. You probably know it well. Just remember to eat food or take it with food and a full glass of water to protect your stomach. We're gonna get into narcotics, and I just use two of the commonly given narcotics here. Morphine, it's an opioid, and it is a pain reliever for severe pain. It also is a sedative, and because it's a pain reliever and a sedative, it causes respiratory depression. So lay terms, your breathing slows down a lot. And that can get scary because if your breathing slows down too much, then you have a risk of dying. So you want to be careful with it. And morphine also causes constipation. So say you had that surgery and they're giving you morphine. A lot of times it's so easy to forget about having bowel movement, but it gives you serious constipation. So you want to make sure you're having some prunes or stool softener if you have to take this medication. It's also used a lot in end-of-life care. So the medication, the way it works, it gives you a strong feeling of comfort warmth, and love. So it's a good thing if you're in pain, but it can be very addictive because of that, because of the emotional component to the medication. So just a heads up. The other medication is oxycodone. Um, Oxycodone and hydrocodone, these are semi-synthetic medications. They are, we call these the big guys. These are strong ones. You had surgery, you're in some serious pain, they will give these to you. They are highly addictive, and you want to be careful with your anti-anxiety medications. If you are taking them, do not take it with anti-anxiety medications together unless your doctor prescribes, and I would even space it out if you do have to. And these medications you really do not want to be taking mixing with alcohol because they're so strong. For some reason, on the nursing side, for some reason, I have seen people do really well on oxycodone, and then hydrocodone does nothing for them. And then other people, hydrocodone works wonders and oxycodone does nothing. So it's up to your body. Everybody's body is different and your response is different. So if you do notice that for yourself, just make a note of it for next time if you have to have surgery. It's good to know which one works better for you. Always speak up for your care. Okay, so speaking up for your care is something I really want to touch on. I want to spend some time on this because as a nurse, we see a lot of people signing papers. They give you a lot of papers to make informed consent, but you're not informed. And a lot of people, they feel bad to say, I don't know what's going on, or I don't know exactly what they're talking about. So I just want, when it comes to especially pain medication, you really need to speak up because there are two things that can happen. One, you can have ineffective pain control. A lot of people, they're scared of becoming addicted to these medications, so they don't take them when they really need them. And because they're not informed as to why they need it or how it works, they just suffer in pain. And another is the patient who thinks the doctor is well aware of everything in their life and everything the doctor orders they take without question. And so it becomes really easy to become addicted to these medications if your care is not well managed and well communicated. So I have a brief video just to show you, just to educate you on how addiction happens. There's a lot of stigma with prescription medication addiction, and I think a lot of that comes from not being fully aware of how addiction can happen and how it can happen to anyone very innocently. So I have a video here I'm going to play on what happens to your brain when you take opioids.
This is Susan. Susan loves to bike. While out for a ride, she falls and breaks her arm. Special cells called neurons send a signal through the spinal cord to the brain, which interprets the signal as pain. Susan understands the pain means she needs to go to the hospital, and her body is equipped for survival, helping her not to panic so she can seek help. Many of her neurons are covered in proteins called opioid receptors. These receptors act like a brake to slow down the neuron's ability to send pain signals. When injured, her body releases natural painkillers called endorphins. Like a key in a lock, endorphins activate opioid receptors, slowing down the pain signal and preventing a panic. Susan gets treated for the broken bone, but 3 months later, her arm still hurts. And now that pain is making her feel depressed and anxious. So her doctor prescribes an opioid painkiller. There are many different opioids, but they all share a chemical similarity to our own endorphins. This allows them to bind to the same opioid receptors and stop pain signals. But that's not all they do. Deep inside Susan's brain is a region called the ventral tegmental area, or VTA for short. The VTA is full of neurons that produce a chemical called dopamine. When something good happens, dopamine is released, giving Susan a feeling of pleasure. This helps teach her brain to keep seeking out good things. To keep dopamine neurons in check, inhibitory neurons keep the brakes on until something good comes along. Just like the pain neuron, these neurons are covered in opioid receptors. When Susan takes the painkiller prescribed by her doctor, the opioid receptors turn off the inhibitory neurons and release the brake on the dopamine neurons. The rush of dopamine temporarily eliminates Susan's depression and anxiety, and she feels relief, calmness, and even euphoria. As Susan continues to take the painkillers, her brain responds by trying to regain its balance. Her inhibitory neurons work extra hard, even when the opioid receptors are activated, and it becomes harder and harder for her dopamine neurons to release dopamine. Susan finds that she needs to increase her dose of painkillers in order to feel comfortable. This is called tolerance. Eventually, Susan's pills run out. Inhibitory neurons that had been working overtime are let loose, clamping down on those dopamine neurons and shutting them off almost completely. Now, not only is Susan in pain, but the depression and anxiety come back. On top of that, Susan feels ravaged by an inescapable physical sickness far worse than any flu. Susan's body is going through withdrawal. Most people who take opioids for a long time tend to experience some withdrawal, but they can still stop taking the pills and return to normal. But for people like Susan, it's not so easy. Her genetics and the environment she grew up in put her at a higher risk for addiction. Her withdrawal symptoms aren't just unpleasant, they're unbearable. Susan thinks the only way to feel normal is to find more opioids. And this is how the cycle of opioid addiction emerges, driven by a brain trying to regain its balance. But there is hope for Susan. Though the road to recovery can be challenging and there may be setbacks, treatment can retrain Susan's brain. With the help of medication and therapy, Susan finds pleasure in her life once again.
Okay, so hopefully that shed a little bit more light into how addictions happen. Communication, effective communication. So effectively communicating with your healthcare team. Sorry about that. Okay, effectively communicating with your healthcare team, it definitely involves you speaking up. I have a quote here from Dr. Martin Luther King, and I think it applies here. It says, "Our lives begin to end the day we become silent about things that matter." Dealing with pain medication, even addiction, is something that really matters to you, not just your life, but to everyone else around you. So if you notice that you have a problem, or you're slipping into a problem, or even you're scared about having that problem, speak up to your provider. Let them know. They can put all the things in place so that you do not become a victim to these narcotics or these opioid medications. Depending on what setting you're in, one thing a note I would give you, some people, they have many different types of providers. They may have mental health providers, they may be going to a pain clinic, or they may be seeing a specialist. Something that I have seen, unfortunately, in the hospital is getting different types of medications from different providers. and they don't all communicate with each other. So what I would usually tell my patients, my family, my friends, is to write down a list of your current medication and any supplements that you take on a daily basis, and just keep it with you in your wallet, like along with your advance directive or any other important documents you may have. Just keep it with you. And when you do go to the doctor, a simple question that you can ask whenever they write you a new medication, looking at your list, you can ask, doctor, how does this new drug interact with the medications I'm already taking? That is an empowering question that will keep you safe, that will keep the doctor practicing very safely. It's just a really good question to ask. So how does this new medication interact with what I am currently taking? Okay. And it's okay. Some people, I've seen some little ladies do major surgery and they go home on Tylenol. I'm not saying that it's for everyone, but you know your body. I'm giving you the keys. So now you can just ask for what you need. And if you don't think you need something that strong, you could communicate that. And same like if you think you need something a little bit stronger, you could communicate that as well. And you could communicate your fears as well. The communication is better if it happens before than after. So that's just my little nursing tip for you. And going into nursing tips, let's go talk about nursing management. What does a nurse do? Well, a nursing diagnosis is very different from a medical diagnosis. Sadly, most people only hear about nursing diagnoses when they're in school, nursing school, because you have to formulate one and treat your patient. But it is part of the care that you receive, and it's a very important part. Remember, I talked earlier, the doctor is treating the disease, the nurse is treating you. So in managing the person, right, we just as a example of what I'm talking about, because some people, they may not know what I'm talking about. Okay, so you go to the doctor, you say, doctor, I'm having pain, right? And the doctor say, oh, didn't I give you medication? And they say, yes, but I'm still having pain. And so the doctor pulls out his prescription pad. Well, now it's electronic, but then he starts getting you a stronger dose of a medication. Well, the nurse, before, she wants to know, well, what's really going on? Have you been taking your medication as prescribed? Or maybe some people, they stop taking your medication because, not that they don't want to take it, but it made their stomach hurt, or they just didn't feel right, or maybe for other reasons, like they couldn't afford the medication, or they are taking the medication, but life never stopped. They have kids, they have to, take the kids to school, and, they're working a full-time job, and it's just, life just happens, and they can't even rest to allow the medication to work. So there are a lot of different things why a patient we call it non-compliant, why they may not be taking the medication, or why the medication may not be working for them. So from the nursing perspective, we are not dealing with the medication as the issue. We're treating the patient. What's going on? How can we help you get out of pain? How could these medications, how could your life really work for you? So just the advocate, we're not judging you. We're not here to judge you, just the advocate for you. So going on to advocacy, it's the coordination of care. So there's a lot of people who come together to help you cope with pain in a practical way. So you could say it more like, we will help hold your hand on the way to recovery. So you have a what you call an interdisciplinary care team that is formed, and you have the nurse, you may have physical or occupational therapy, social workers, and insurance. Usually case management can be attached to the hospital, or case management can be attached to your insurance team. And all of these people are here to work for you. And the nurse is communicating with you about your pain so that she could communicate well with these other members of the team to help you. The team, usually this coordination of care happens just one time. And unless you're in long-term care, this is where a lot of the ball is dropped when a patient is discharged from the hospital and you have all these people working on your team at the hospital and things are happening and you go home and it's just you. There's a lot of readmissions into the hospital because of it, because they don't fully communicate that we're working to empower you. So just a little bit on the care team. This is where communication really works. You want to know who's on your team and what they're doing and how you can work with them. So that when they give you the keys or your discharge paperwork and you leave the hospital or the clinic, you really know what you're doing and how to do it. This gives you the responsibility, trust, honesty, commitment, accountability, all of this. If you are going to drive a car, you automatically will have responsibility. And sometimes it is difficult because I'm talking from personal experience. When I was in the hospital as a patient, I'm a nurse. And sometimes I didn't want the responsibility. But knowing that you can do it, I'm here to tell you that you can do this. You can care for your health. And a big thing in caring for your health is communication, trust, and honesty. You want to know when you're communicating with your healthcare team that you trust them and that they are honest with you. If you don't have that rapport, I would say it's okay to keep searching for trust and honesty in your healthcare team. When you are in pain, it's very difficult to communicate because you're hurting. So if you don't trust them and you don't think they're honest with you, your pain will not be effectively communicated. You don't want to have others make decisions for you. So you may find a team and it's easy to say, my doctor knows me very well, my team knows me very well, whatever I need, they have it done. But you really want to stay in the driver's seat of your healthcare. I have seen, unfortunately, in my experience, people, they have given others, do what you want, give me what you want, whatever you think is best. But unfortunately, they have to live with the outcome. So, and sadly, sometimes the providers aren't anywhere to be found. So you really want to be in that role. You want to know your role, and I would just encourage you to pay attention to what you are consuming in terms of healthcare. When it's time to make major decisions, it's okay to slow down, and it's okay to take notes before and during your appointments. Definitely, that's my nursing tips for you. Another nursing tip I have for you, as far as your role, when it comes to pain, you want to ask, how will this treatment affect me in the long run? So it may be all good and well for now or for next 3 weeks, but 6 months from now, it actually puts you in a worse position. So it's just an empowering question for your provider. How is this treatment gonna affect me in the long term? And another thing I would say is that trust and honesty, it really goes both ways. So you also want to be very honest with your provider, and you want to build trust. You want them to trust you as much as you trust them, because it's really a relationship. And what helps with that trust is effective communication. Not just saying things, but purposeful, knowing what you're saying and why you're saying it. So, I have a little note here that says, no one can commit to your good health more than you can. So as healthcare workers, we do our job, we are here for you, but they respond even better when they notice that you are just as committed to a good outcome as they are for you. So after going through that, I really hope so far in this class that you have a clear distinction of what your doctors do in terms of helping you manage your pain, what your nurses do to help you manage your pain, and this why it's good to know both. Some people say, oh, they're just there to help me. Okay. And I just give you a short example of why you should know both. Why am I even presenting this material to you? So I have been in the hospital and the doctor's there, and the doctor says, can I do anything else for you? And the patient goes on to say, they messed my breakfast up. Nobody even came to clean up the room. And who's gonna get my medicine at home for me, right? And then the doctor says, shaking his head like, I have no idea what you're talking about. The doctor leaves the room, and then they ask me, okay, that medicine, it's not really helping me. Could I get a higher dose? Or could we try something different? So knowing what the nurse does versus what the medical team does, it really helps ask the right person the right questions. Not that I can't help you, but it'll take me all day, my whole 12-hour shift, to track that doctor down and make those changes. Whereas if you knew, you could ask the right person. On the other hand, you can really utilize your nurse. So many times we get so task oriented, but your nurse can do a lot more than just give you the medication to relieve the pain. A lot of times people in pain who have pain, they become very, very nervous as to it's something new, and it affects so much of their life. And sometimes in my practice, I just take a moment, I sit down with my patient and just listen, just hear what they have to say. In nursing, we have something called critical thinking. So sometimes they are trying to figure out, well, how am I going to fit this pain into my life? Life cannot stop. So that's where you have your nurse can help you put the pieces together. We are trained to be critical thinkers. So you have that resource available to you. It's not just about not feeling the pain, but all that the pain brings on. And this is where a nurse coach even is, they offer it in the United States. I don't know for different countries, but with your insurance company, even a nurse coach can help you figure out how to deal and how to treat not just the pain, but all the other things that comes with the pain. So just being an advocate for you, just sharing that information with you. In advocating for your health, we will speak up for you. We will empower you with what to say. Some people are very savvy. They can navigate the healthcare system all by themselves. It's beautiful to see. I just want you to know that if you do not feel like you can navigate the healthcare system for yourself, don't feel bad. Like I told you, I'm a nurse and sometimes it overwhelms me. I've seen doctors, I've had doctors as patients, and when you're a patient, everything you know comes right out of your head. So don't feel bad if you don't know how to advocate for yourself. This class, those questions that I have been giving you, that helps you to advocate for yourself. Because advocating does not mean that you know everything. It just means you know who to ask and what to ask. And that's how you can speak up for yourself. When you start asking the right person the right questions, they know you know what you're talking about. Even if you may not, but it sounds like you know what you're talking about. They know that you are an informed consumer and you will get a very different response. So I really hope that this class has helped you and empowered you in that way. Very quickly, I'm just going to go through some of the resources that you can have. We talked a lot about the hospital. In the hospital, outside of the hospital, you have nursing assistants, home aid, home health nurse. Just a tip on that, the nurse actually writes a care plan, and the care plan is what helps your assistants and your aide not be just a housekeeper at home, but a nurse writing a care plan. They can actually help you with your pain by doing your range of motion exercises, etc. Not just doing like only house chores. They will function more like if they're working in a facility. Some more community resources, family, friends, pets, big time. Works well for people in pain. They actually say when you start laughing and interacting with people, some people, they forget about pain. So these are not, we're not gonna neglect these. Holistic, so many people are looking at alternative ways to deal with pain, especially because of the narcotic and opioid problems happening. I am actually on the path to become a holistic RN. So I am going to have a class dealing with this. A lot of people are asking about CBD oil at the moment. And we'll talk about that in the future. Stay tuned, stay tuned. Exercise, keep moving. So some people have specific exercises, but whatever, don't push your body, but whatever you can to keep moving really will help in decreasing pain. Nutrition, turmeric and tart cherry juice helps. Turmeric is, people are saying it works wonders. It acts as an anti-inflammatory, so it works very similar to ibuprofen. And tart cherry juice, some people take a little bit, and it works wonders for them. I had the video here, but I'm just running out of time, so I'm gonna keep going because I really want to hear what your questions are about this presentation. So if you could take away anything from this presentation today, it would be pain is communication. So when you effectively communicate your pain, it will help you to have effective management of that pain. And that I also want you to know that your nurse is here to advocate for you, to empower you, to help you to manage not just the pain, but remember how the pain affects your life. Okay. So I'm gonna, I think I'm gonna open it up in a little bit for questions. I just thank you so much for joining. Next topic, we will be talking about breathing, respiratory, COVID-19. A lot of people are wondering about what can I do at home to help me? So we're going to talk about respiratory next time. And this is our website. This is all of our contact information. And like I said, this is going to be posted to YouTube. So if any of this is helpful or you think this information can help someone, feel free to share and forward. And this is our email address. Feel free to email with any questions or queries. Okay, so I thank you so much for joining us, and I am going to stop sharing now so I could see your beautiful faces and open up for questions and answers.
Hold on.
That means Terry buy some more. Why is this? Okay, okay. Okay.
Okay.
You did a good job, honey.
Okay, thank you, thank you. Thank you for coming. Now, does anybody have any questions?
When is the next session?
Yes.
Oh, yes, please stay tuned. I'm gonna do it a month from now. And the next time I do it, I think I will do it on weekend, because a lot of people, they have to work. So I will do it on the
Okay.
weekend. Yes.
All right. But it was very clear and informative. Thank you.
You will.
And I like the point you made about keep moving, keep walking, keep doing.
Yes.
Because when I sit, it hurts more. That's why I have to get up and keep walking around. Yeah.
Yes, yes. And I have a Deborah Morgan has a question here. You can feel free to unmute yourself.
There we go. I couldn't unmute myself. Okay. My question, unfortunately, I joined a little bit late, and I did notice that the program was being recorded. Is there some place that I can, get that recording so that I can, hear the whole presentation? And what I did here was very informative and enjoyable. Just let me get that out there as well.
Thank you. I appreciate your support. Yes, you can. It's on YouTube. It's going to be on YouTube. The Spark is Love. You can type that in, or you can, if you email me at thesparkislove@gmail.com, I can send the link right over to you.
Okay.
Thank you for joining.
Yes.
Okay, my name is Edwards Almo. I'm in Trinidad, and I really am so happy that I got on because sister had given me the link, and I appreciate everything that you said. Something I can agree with is one asking questions. Sometimes I go to the doctor and they just tell me this and tell me that. I don't know, ask no question. Even I went to New York, they gave me tablets. They say the one I had was too low, and it wasn't working until I came back and I got a different thing that is working. I suffer with high blood pressure, and it works well. So, that question about asking your doctor question, why are you giving me this? Why did you change that? It is very welcome with me. Also the walking, up and down. I do take exercise. Now they closed down, but I still try to do it at home. And it's helping because I am very complicated. A lot of different, surgeries I had, hospital for a year, different surgeries, replacement of hip, all different things. And I'm not a young person. I am 80-something. So I'm still, fighting with a lot of things.
Yes,
but I still try to stay healthy. And I would really love whenever the program is coming on, I love to take tips about eating and stuff. Do I try to change my diets and stuff?
Yes,
but I don't want to stay on and on. I know many people have things to say, but I thank you so very much. And I'm really interested.
You are so very welcome. You're so very welcome. And I have another question. Thank you so much for coming. Trendies, you can unmute.
Okay, there I am. I'm muted. Yeah, thank you so much, Casey. This was so informative. I just came with an open mind to understand everything. Some of the information I was aware of, and then other things that just added to my knowledge. So I appreciate that. One of the things that I really like that you mentioned that I look forward to you taking this on is the holistic part of it. That's something that I advocate for myself because I don't want, addiction to drugs and different things, because I've lived with a chronic pain for at least 25, 30 years. I've lived with chronic pain, different in my back because I had a car accident. So I'm a person and I've had to manage it for a long time. And so any of the other different pain that the opioid and the other things, I've never been one to go into that, because I felt I want to live longer and your organs and other things can be affected and impacted. So I never wanted to attribute it to doing that. So moving a lot, I get up and I go walking a lot, running if I can at times, depending on how I feel, whatever my body will allow me to do. But turmeric is something that I take almost on a regular basis. Turmeric that you mentioned. So the natural things that my body can identify, and it can be assimilated into my body, that it can accept it without having a huge impact or side effect to my body. So when you go into the holistic part of it, I am definitely on board to know more. And I'd like to share notes with you because I've been using those things for a long time.
Sure, sure. I'm actually, yes, I'm gonna be getting my certification in holistic nursing. So
Yes.
I definitely would do a class. Just, pain is so vast. So I'm
Yes.
just going to break it down into little pieces.
Okay.
Yes.
Thank you.
Look
I
at
really
you
appreciate it.
coming.
Yes, it was very, very
Thank you.
informative. Thank you.
Oh, thank you. Thank you. Anybody else has a question, or Sister Williams?
Yes, yes. I am one of those who had chronic arthritis pain and went through pain management, went through all kinds of medications, and finally settled upon one. It was an opioid, synthetic. And now with the opioid crisis, doctors are taking you off of everything. Okay, so they take you off, you can't get things. So where do you fill the void?
Yes.
And so my situation is this, looking for something. I'm taking an anti-inflammatory prescription, but that's still an anti-inflammatory. It's not really taking the edge off the arthritis pain when it flares up, which is mostly every day. So that leaves you a void. So what are the trends as far as what what they're suggesting to replace the opioids that people have been taken off of?
Yes, yes. This
She switches back. No.
that's a very that's a very common thing we're seeing in the hospital. They're doing a lot of research right now with CBD. I personally have not, I haven't finished my course yet, so I cannot speak on it, but I have had a lot of patients, they've been using CBD oil and they say it works very well. I'm not good. I think that's from my class today, I think something that I highly recommend as a nurse is to discussing with your doctor alternatives. If they're going to take you off of a medication, what are they offering to you? And if they don't have alternatives for you, have you tried other approaches? Like, have you seen any holistic practitioners? That's just my recommendation for you. Sometimes it may be the provider. A lot of doctors, and I will stand up for them, they don't really learn holistic practices in school. So they are not aware of the holistic side of managing care. That's not what they study. They study medicine. So sometimes you can work with your physician and see how he feels about you following someone on a holistic side to treat your pain. Or you can find another provider who just see what their options are. I don't know if that is helpful to you, but what I'm trying to say is, as a nurse, I want to empower you to find the care that is best for you. See, not one thing doesn't work for everybody. And sometimes it's just about a question, asking a question. And if they don't like you asking questions, you can find someone who does like asking, like you to ask questions, and would be humble enough to say, hey, I don't know, but let me see what's out there for you, you know, instead of just you living in pain, because that's not good for you to just stay in pain.
And then one of the things I'll let other people talk. I did mention that to my physician. Look, everybody's taking you off of things, and you do need to have something that help you. So he was open to me bringing up what things. I think they have this problem. They don't want to say, well, what about, let me think about this, or what about this? They're thinking about their liability and so forth. So it was fine as long as I brought it up. Okay, that's fine. You can work with that, and you can see if that works for you. But I had to bring it up. So I'm not getting,
I found that.
why don't I let you try, why don't you try this? They don't do that. No, I get worried about their medical liability. So I had to just speak up. What about this? What about that? And then what I'm going to do, I'm going to go try it and see if my body reacts to it. That's what I'll do.
Yes, and it's my goal, it's my vision. This honestly is my first class, but it is my vision to get more people on board with me, because people are not aware of what's out there. And you know, not everybody have your best interest at heart. So some people, they're just in it for the money. And I'm working with a different currency. I'm working for helping people. And there are a lot of practitioners out there who do alternative, and they are interested in helping you. And so if you keep I hope to bring some more people. They have products, they work with natural health, and they have many resources for you. So stay tuned.
I would be interested. Yes, thank you.
Yes. Okay, I think I used up all of my time. Thank you so much. Your time is very precious to me, and I really appreciate you joining in. I am doing this because I am grateful for each and every one of you. I think society has charged people for information, and I don't think information should be charged. I think we should pay for services, not information. Healthcare, people are overpaying and underserved, and I'm just not going to stand for it. I stand to overserve you. I stand to everything that I have. And if I don't have it, I will find the resources to get it to you. So email us, let's stay in contact, and we'll be having more of these classes. I thank you so much for joining.
Thank you.
Thank you. You're welcome. Thank you for having us.
Yes,
love you.
Day. Love you too.
Thank you.